The 1918 influenza pandemic, commonly known as the Spanish flu, stands as one of the deadliest pandemics in recorded history. Emerging during the final months of World War I, this viral outbreak affected millions worldwide and reshaped public health responses for generations to come. Welcome. We provide you with interesting and informative content. I am Adnan. If you also want your information to increase, stay with us and watch the video till the end. The origins of the 1918 flu virus remain somewhat unclear, with theories suggesting it may have originated in birds or swine before mutating to infect humans. The first cases were reported in military camps in the United States in early 1918, but it quickly spread to Europe and parts of Asia. By the spring of that year, it was evident that a new strain of influenza was circulating. The initial wave in the spring of 1918 was relatively mild compared to what was to follow. Symptoms included typical flu manifestations such as chills, fever, fatigue, and muscle aches. Most patients recovered within a week, and mortality rates were low. However, public health officials were already on alert due to the unprecedented spread of this new virus. In the fall of 1918, a second wave emerged with alarming ferocity. This wave was marked by a higher virulence and significantly increased mortality rates. Victims often succumbed within hours or days of showing symptoms. The clinical presentation included severe pneumonia characterized by cyanosis, a bluish discoloration of the skin, difficulty breathing due to fluid accumulation in the lungs, and rapid deterioration leading to death. This second wave disproportionately affected young adults aged 20 to 40, an unusual demographic for influenza-related fatalities. It is estimated that between 50 million and 100 million people died globally from this pandemic, with an estimated mortality rate ranging from 2% to as high as 10% among infected individuals. In the United States alone, life expectancy plummeted by about a dozen years during this period. Reports indicated that some communities faced staggering death tolls. For instance, cities like Philadelphia experienced thousands of deaths within weeks. In response to the escalating crisis, cities implemented various public health measures aimed at curbing transmission. Mask mandates became common. Citizens were required to wear gauze masks in public spaces. Schools were closed, theaters shut down, and gatherings were banned as part of efforts to promote social distancing. Healthcare systems struggled under the weight of overwhelming patient numbers. Hospitals became overcrowded with patients suffering from severe symptoms. Makeshift medical facilities sprang up in schools and community centers to accommodate those seeking care. In some instances, bodies were piled up outside hospitals due to insufficient morgue space. Public health campaigns emphasized hygiene practices such as hand washing and respiratory etiquette, covering coughs and sneezes. Despite these efforts, misinformation about the disease proliferated alongside fear and anxiety about its spread. The societal impact of the pandemic extended beyond immediate health concerns. Economic disruptions occurred as businesses closed or reduced operations due to illness among workers or government mandates. The psychological toll on communities was profound. Fear of contagion permeated daily life. The end of the pandemic came in early 1919 when cases began to decline sharply. However, its legacy endured long after its conclusion. The experience underscored the importance of public health preparedness and highlighted deficiencies in healthcare systems worldwide. In subsequent years, governments invested more heavily in public health infrastructure and research into vaccines and antiviral treatments. The lessons learned from the Spanish flu influenced responses to future infectious disease outbreaks, including those seen during subsequent pandemics such as H1N1 in 2009 and COVID-19 in recent years. The 1918 influenza pandemic serves as a stark reminder of how rapidly infectious diseases can spread across populations with devastating consequences. Its historical significance lies not only in its immediate toll on human life, but also in how it reshaped public health policy and societal attitudes toward disease prevention and response strategies for generations to come. As we reflect on this dark chapter in history, it is crucial to remember that vigilance against infectious diseases remains paramount, highlighting our collective responsibility toward global health security today.